Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of obstetrics and gynecology with the topic labor, and the subtopic will be stages of labor. So let's start.
Hello, welcome to this assessment on obstetrics and gynecology. Today we'll focus on the stages of normal labor and postpartum hemorrhage. To start, could you describe the 4 stages of normal labor for me?
The first stage is the dilatation stage. The second stage is the expulsion state, which begins with full cervical dilatation and ends with the delivery of the fetus. Third stage is the placental stage, which begins after the baby is delivered and ends with the delivery of the placenta and fetal membranes. And the fourth stage is the period immediately after delivery, focused on uterine involution and adaptation to blood loss.
That's right. You've mentioned the definitions of all 4 stages. Now, could you tell me when the first stage of labor begins and what are its 2 distinct phases? Any advice provided is not medical advice or diagnosis. See a healthcare professional for care and diagnosis.
The first stage, which is the dilatation stage, it begins with true labor contractions and ends with full cervical dilatation, which is 10 centimeter. It includes a latent phase and an active phase.
Exactly. And what about the second stage? Can you describe the mechanism of labor in a vertex presentation, specifically occipito anterior? Just give me the movements in sequence.
I don't know. Can you please tell me?
No problem. Let's break it down. You have engagement, then descent, flexion, internal rotation of the head, extension for delivery of the head, followed by restitution and external rotation, and finally expulsion of the body. Now, thinking about monitoring labor, what do you know about a partogram? What's its purpose?
The systemic assessment of maternal and fetal well-being, along with the progress of cervical dilatation and descent to ensure a safe delivery, is the monitoring of labor, and it includes a partogram to track progress, assessing fetal heart rate via intermittent auscultation or electronic monitoring, and evaluating maternal vital signs, uterine contractions and rupture of membranes.
Yes, that's a good overview of labor monitoring. Now, thinking about the third stage, you mentioned placental delivery. What is the active management of the third stage of labor and why do we recommend it? What are the main steps involved?
The placental stage begins immediately after the birth of the baby and ends with the delivery of placenta and membranes.
That's right. That confirms the definition of the third stage again. But can you tell me specifically about the active management of that stage? What are the uterotonic drugs used and how is the placenta delivered?
The active management of third stage of labor is to reduce the risk of postpartum hemorrhage. We give uterotonic drugs, which is 10 IU of oxytocin within 1 to 3 minutes of the baby's birth, controlled cord traction and uterine massage.
Excellent. Those are the key steps. Now let's consider a clinical scenario. You have a patient who has just delivered and she starts bleeding excessively. What are the very first immediate steps you would take? See a healthcare professional for medical advice or diagnosis. Any advice provided is not medical advice or diagnosis. What would you do first?
The initial management is to evaluate and assess airway, breathing and circulation. We will give fluid replacement, and we will give oxytocin 10 to 40 IU and tranexamic acid and uterotonics like carboprost.
Those are all critical measures for resuscitation. In addition to starting medical treatment, what do you think is the most important assessment to do simultaneously to determine the cause of the bleeding? See a healthcare professional for medical advice or diagnosis. Any advice provided is not medical advice or diagnosis. What would you prioritize in your examination?
We can also give bimanual massage, balloon tamponade, uterine artery embolization, or surgical procedures like hysterectomy.
Those are indeed management options. But before going to those surgical procedures, assessing the uterus for uterine tone is vital, as uterine atony is the most common cause. Now, finally, if you're confident about that, what can you tell me briefly about the methods of induction of labor when spontaneous labor doesn't start?
I don't know. Please, can you explain?
Certainly, methods include mechanical methods like cervical dilators or membrane sweeping, or medical methods, often using prostaglandins to ripen the cervix and start contractions, or oxytocin. We've covered quite a bit today, from the stages of labor to partogram, PPH basics, active management, and induction. Well done. Is there anything you would like clarifies further?
No, thank you.